Okay, hello. Um, my name is Alex, and I'm going to go ahead and get started. My topic was PICC line and peripheral IVs. Um, I'll start with a video first, and I'm not sure. Okay, so I'm not sure if the volume recorded on that or not. I'm having some computer issues. But basically, it talked about what a PICC line is, who can insert it, how it's inserted, um, some basic cares, and then it explains that a nurse can take it out. I decided to do this because I talked about both PICC lines and peripheral IVs, and I feel that most patients who visit the hospital, if not all, know what a IV is, but a lot fewer know what a PICC line is. And um, I think that we need to start educating more about PICC lines because they're becoming increasingly more popular. So then I'll go ahead and I'll pull up my pictures. Again, I'm having some computer issues, so I just kind of put them all into a PowerPoint instead of pulling them up all individually. It's just I'm having issues getting my photos to work. So the first picture that I'm going to talk about, it's just comparing central line. PICC line is a peripherally inserted central catheter, so that is a type of central line. And then this, that's the top image there. The bottom one is just the normal IV, and this kind of talks about different times to use them. A lot of times, PICC lines are used for chemo, and that can be good because if you use it in a peripheral IV, the drugs can leak out and reach areas that they're not intended to reach, and that can cause a lot of irritation and even necrosis. I learned actually when I was doing this part, I didn't even find it during my research, that there are 5 different stages of medication for basically how corrosive or toxic it is. Um, the second, and that causes blistering and necrosis. Exfoliant, which causes inflammation and skin shedding. Irritant causes like a burning and a warmth, and then that can affect the pigmentation and cause some tenderness. Then there's the inflammatant, and that just is some inflammation. And then there's neutral, which basically doesn't really affect the skin at all. But using the central line instead of the peripheral catheter, that can decrease the chances of damaging the skin, and it can also help to dilute the medication. So by putting the medication into a larger vein, there's more blood there, obviously, so it's being diluted a lot quicker than if it were to be entering a small vein, say in the hand or the forearm. And then I know that my topic was specifically PICC lines and IVs, but I found this picture, and this talked about different kinds of central lines, and it basically just compared and contrasted them. And I think this is also very important because so few people know about PICC lines or any other kind of central line. So this can help to kind of just inform. The PICC line is by far the easiest one to put in, and it's the most cost effective. But it has the highest risk of infection, although that's still much lower than with a normal IV. It also has the greatest risk of these three for side effects like thrombosis and line migration, which is just the tip moving and not staying exactly where it's supposed to, whether it's the superior vena cava or right atrium or inferior vena cava. And the PICC line can be done fairly easily. It can be done at the bedside, actually. The other ones, the implant port and the Hickman, are both going to be ports that need to be put in by an expert, and they're going to require a lot more cost and a lot more training for people to be able to do that. Then we'll look at IV insertions. This is important because I have really good veins, and I'm not sure how, but I've had people miss them when they're starting IVs. I've had a lot of medical experience as a patient, so I just thought that this was kind of interesting to see, like basically when an IV isn't going to work and when to ask for help. Just by nature, some people don't have as good of IVs, or they have hypotension, and the doctors or nurses are going to have a lot more difficulty reaching the veins. So in these kind of cases, we're going to have to think about using a different line. Sorry, my nephew just walked into the room. But yeah, we're going to have to use a PICC line on some other patients, or a different venous access device. So I thought it was kind of a cool little, I don't know if you'd call it a flow chart, to show like when to ask for help or when to consider different options. And then when I was looking at this, I also found one kind of interesting fact. In neonates and small children, they actually can use a fiber optic light and hold it behind their wrist, and then they'll be able to see the wrist is so skinny that the light can actually make the veins show up, and then you know where to stick with the needle. So I thought that was really cool. This picture I chose because I've had a PICC line, and in my experience, the nurses weren't super sterile with it. They were very clean, but they broke sterility. The more I get into the nursing field, the more I realize like they did not do what they were supposed to. So this just kind of explains how to keep sterility. And that's important for PICC lines. When you're working with just the IVs, you don't need to stay sterile. You can just be clean. But yeah, this will help with the rates of CLABSI and just any other infection or infiltration. So my fifth picture here, I didn't realize how hard it would be to see, but this really talks about looking at the sites and seeing if there's any problems with it. This is for the medical providers, the healthcare professionals, but this is also something that you could teach the patients about so they can be able to assess themselves. It talks about skin integrity, edema, palpitation, temperature, capillary refill, pain, and just kind of tells what normal should be and what abnormal should be. And I'm not sure if you're able to read that. It's kind of small, but it was just interesting this came with a whole article, and it was interesting to see like how much a patient can actually like assess themselves and keep an eye on that. And some patients aren't in the right state to do that, but educating their families in that situation can help to keep them safe even when the nurse or doctor are not present in the patient's room. I added a sixth slide here. If you can't tell, that's me. And that's not the same jersey. That's a different one. But when I was 19, so 8 years ago, I went septic. I had had a lot of knee surgeries, and somehow I got an infection, and I went to all the metal that was in my leg because that was the weakest part of the body. And I actually almost died. I was in the hospital for a couple of weeks. I was on, I had a PICC line for, I believe, 6 weeks after I was discharged. Um, I don't remember a lot of it. I was so medicated, but I remember the doctor coming in and looking at me and smiling, and I could tell it wasn't a happy smile. He was just trying to make me feel at ease. And he took my mom out into the hallway and basically told her to call my dad and my brother and come and say goodbye to me because they didn't think I was going to make it through the night. And it's just that's kind of why I chose this topic. I think that the PICC line obviously saved my life. I don't think that I would be here if something like that didn't exist. And I think it's just so cool that I could go from so sick to 7 months later, I was still having a tough time walking to now I'm running 5Ks and playing in an adult basketball league and just living my best life because of a device like this. So that's my topic. Um, don't really know what else to say. Thank you for listening, and I hope you enjoyed it.